name's McKenna, and I'm going to be your student nurse today. Can you confirm your name and date of birth for me? All right, and that's right. I'm here today to do a respiratory and an abdomen assessment on you. So I'm going to ask you a few questions, inspect, palpate, and auscultate. So I'm going to now lower this part for you and lift the head of your bed up. And have you been experiencing any shortness of breath lately? Have you had any pain while breathing? And do you have a history of asthma or anything? No? Okay. And is it okay if I pull this down for you? All right. So first here, I'm going to pull down your gown and look for symmetry. Everything looks good there, and I'm going to assess the pattern of your breathing. It doesn't look labored. So now I am going to palpate and feel for any tenderness. Do you have any tenderness there? No? Okay. And now I'm going to auscultate on the front here. So just take normal breaths. And I'm going to make sure to listen for a full breath. All right, I'm going to pull this back up for you, and I'm going to lean you forward now. So here I'm again going to inspect your skin and the pattern here. I'm going to palpate. Can you just take a normal breath for me, and I'm going to assess my fingers moving. All right, that was a good breath. And now I'm going to auscultate again here. Can you just continue to take normal breaths for me? All right, good. I'm gonna lean you back here gently. And now I'm gonna lower the head of your bed again. So that was the end of your respiratory exam. I'm now going to be moving on to your abdominal exam. Have you been having any painful bowel movements, any diarrhea or anything like that? No. Have you had experienced any constipation recently? And have you been having any abdominal discomfort at all? No? Okay. So I'm going to pull up the edge of your gown here now. And I'm inspecting your stomach here. Everything looks good. There doesn't look like there's any swelling or abnormal masses. Now I'm going to auscultate before I palpate. So I'm going to look at all 4 quadrants, and I should hear some vowel sounds within the first few seconds, and I do in those quadrants. All right, your bowels are active, and now I'm going to assess your root here. And that sounds good. Now I'm going to palpate, so just let me know if there's any tenderness in any of these quadrants. I'm going to start in your right upper quadrant, and I'm moving to your left upper quadrant. Going to go down to your right lower quadrant and your left lower quadrant. You don't have any discomfort there? Okay, I'm going to pull your gown back down for you and pull these sheets up. That was all that I needed to do for my respiratory and abdomen assessment. So I'm going to make sure that your bed is locked up again. Now it is locked. Are you in a comfortable position? Okay, I'll come back to check on you in a little bit. Thanks.